to the Trusted Dentist podcast, where we talk all things dental and answer the questions most people are afraid to ask their dentist. Hi, I'm Dr. Ved Barani, and I'm joined with Mariah, who's going to be asking all the tough questions. And today's topic is about dental anxiety and fear. Is it real?
My gut says it absolutely is. So let's start off with, where does dental anxiety come from?
Dental anxiety is a real thing. It's no different to height of fears or water or fire. We can have these inbuilt into our brain at a very young age. Let's take, for example, when your mom takes you to the dentist. Maybe your mom's had a bad experience, and what she says in front of the dentist when a 4-year-old is having an exam is, "Don't be afraid. He's not going to hurt you." Guess what the child's thinking at that point? The child has zero experience of the dentist. However, the mother has just instilled a small seed into the child's mind about the dentist. From there, unfamiliar surroundings, strange sounds, and also poking into your mouth are all uncomfortable things. And these can then start off as developing an imprint of bad experience into your mind. And that sometimes is just a small root cause of something that can become even bigger. Some people and some patients I see have had some really bad experiences, like forceful treatments, being pinned in the chair, and drills gone in the mouth without local anesthesia, and all this has created a massive fear in the patient's mind. So yes, dental anxiety and phobia are both real things.
Yes, that sounds very scary. What can patients do to help themselves feel a bit calmer before going to the dentist?
Look, for most people, having an understanding of what's going to happen is a huge part of it. So if your treatment's been explained well, if you have been informed and read up about what the treatment entails, if your dentist has taken you through all the little steps that are involved in doing the treatment, it'll help you relax a little bit. Apart from that, I tell some of my anxious patients to just have a quiet morning. The appointments are usually scheduled earlier in the day rather than late, and at the same time have a stomach full of sausages. Or, if you're a vegetarian, get some granola cereal in you with some honey. Sugar definitely helps cope with stress, and sometimes listening to calmer music on your way to the dentist can help as well. But again, Mariah, these are techniques for people who are normal, who generally only have some superficial anxiety. For some of the other ones where it is deep-rooted, there are much more that we have to do before their appointments.
Okay, so can we go into that? What are the options for people who are so scared, even just calm music or sugary food beforehand, that's not going to cut it? What can they do?
Look, for people who actually have a real fear, it's important to seek a dental professional who has some experience in dealing with these kind of patients. That's number one. Having a non-judgmental, non-salesy consultation with a dentist with that level of experience will help you just understand the problems first. Making sure you develop open communication with the dentist is super, super important. Talking to them about exactly what it is that is your trigger point. Is it the smells in the dental office? Is it the noise of the drill? Is it the water that keeps getting caught at the back of your mouth and you feel like you're drowning? Or is it just the fact that you're not in control? So many different things can trigger it. So from my point of view, that's your good starting point. From there, in our dental office, which does a lot of what we call as sleep dentistry or sedation dentistry, you could have anything from a very mild oral sedation, like an oral tablet. We call it a sleeping tablet or an anti-anxiety tablet prior to your appointment that can help calm your nerves. And that obviously has to be done with a prescription, with the right kind of before and after care, making sure someone's driving you to the appointment. In our dental office, we have what we call as laughing gas as well, which is used very commonly. We have multiple units of that. And a lot of our patients have some non-complex treatment with the laughing gas, such and general treatments like fillings and cleans. Laughing gas is what we call as is basically nitrous oxide oxygen. It sits with a hood on the nose, and the patient breathes through it, and that helps them calm down a bit. From there, we also have options of what we call as general anesthesia, which we call as complete knockout. You could be put to sleep 100% under the care of a specialist anesthetist, and then the dentist can come in and do whatever treatment needs to be done. Again, has to be planned for, and every patient has to be assessed for suitability.
Okay, so what are the steps that somebody should take if they feel like they need to be completely knocked out? What would they expect from start to finish?
So once the patient comes in and has a really strong, open consultation with their dentist, we would present them with a treatment plan. The treatment plan would have all the different options available for the patients, along with risks, pros, and cons. This would be followed by a second consultation, usually with a partner or a family member or a friend. And then from there, we would do certain what we call as assessments of their medical health. So it might be an ECG or bloods to make sure they're suitable candidates to have a general anesthesia. On the day of the appointment, we have an entire plan, and we have a specialized operating theater in our practice where patients are put to sleep under the care of a specialist anesthetist. And that means that they have to be fasting about 8 hours prior. And then from there, once the treatment's complete, they would go into our recovery room where they would stay for a few hours until they're ready to go home. The beauty of this treatment is that patients are completely sleeping during the entire dental procedure. Whether it is extractions, whether it's a root canal, or a dental implant, or a crown, or a filling, everything can be done in our day surgery procedure center where all dental treatments can be done under sleep. You will have zero memory, and a lot of dental treatments can be done in one long general anesthesia. So we have a lot of patients travel far and wide to come to our practice just for this.
Okay. This leads me into my next question. I'm sure you have a lot of patients who are older who maybe haven't seen the dentist in 20, 30, maybe even 40 years.
Yeah.
What can they expect has changed from modern dentistry that we're in right now to what they experienced all those years ago?
It's a great question, because that is exactly what my patients tell me is the reason they haven't come in is the memories of the dentistry they had 20 years ago, even 30 years ago. The options were very limited, and the only options patients had was pull the teeth out, have dentures, or have extensive silver amalgam fillings. Right now with modern dentistry, we do minimal invasive treatments. We do not drill as much teeth out as what we used to do 30, 40 years ago. We have preventive measures we can put into place to remineralize the enamel. We have treatments that can be done with painless injections that we can give, or let's say minimal pain injections, because we have ability to give our patients some numbing gel which helps numb the gum before the local anesthetic goes in. In our practice, we also practice what we call as slow dentistry. So allowing enough time for the local anesthetic to work for our patients means that the anesthesia is more profound and there's less need to go back and keep giving more injections, which is also a very common thing that my patients tell me all the time was the dentist attempted 5 injections before they could do something, and I cannot be numbed up. And there might be 1 in 100,000 who has an anatomical variation where local anesthesia doesn't work. But for all other people, it does work as long as you use the right one and allow enough time for it to work. So putting all these little bits and pieces in place, along with reassurance and developing some strong trust and bond with your patient, is the real key.
That is a lot of very good information. So, what I'm hearing you say is communication between a dentist and a patient is very, very important. Is that right?
Absolutely, absolutely. No different to you going to a cardiologist. He's not going to open you up and do a triple bypass just because he feels like it, right? You got to ask all the questions, you got to know what your options are, and also make sure that you understand what the risks of the procedure is. We also do a lot what we call as photography, diagnostic photos for our patients, because seeing is believing at the end of the day. If I'm telling you that your upper right's last molar on the upper right side has got a cavity in it that has taken away 2 walls of the tooth, you can't see it, right? but a good diagnostic photo will help you understand this problem. And that's how we work, with good photography, good diagnosis, comprehensive checkups, and thorough x-rays.
Amazing. So, if somebody is looking to find the right dentist for them, I know this is something we've discussed in previous episodes. I would love to hear again how somebody can find the right dentist for them.
Yeah. I'm assuming you're referring to patients with dental anxiety.
Yeah. So somebody who maybe has been looking for the perfect person who's going to make them feel confident going in.
Sure. Look, there's no perfect dentist,
Mm.
just like there's no perfect patient, right? However, a good starting point would be Google. If you Google sleep dentistry, you would come up with some providers who do offer that in Melbourne metropolitan region. Look at their reviews, read what other patients have written about them, and very importantly, then make your assessment based on your own experience at your first consultation. It's really important to understand if the facility has the right safeguards to be able to provide sleep dentistry as well. Because not all dental offices are equipped with the right equipment and specialist anesthetists to do this. And that's something that you will be able to assess once you visit that dentist. Asking them questions about their experience dealing with anxious patients is also important. Maybe at that point in time, always take a family member or a friend with you, because it's important to have someone who can hold your hand, get through that initial first appointment. It's not easy. We understand that. And that's why it's important to allow enough time with your dentist to be able to understand the process.
Amazing. So, what's your advice for someone who's ready to take the first step towards seeing a dentist after years and years and years?
I would say do it yesterday. There's no point in waiting because the problem's not going to go away. It only gets worse. Just recently, a quick story. I have a patient who saw me at 78 years of age. He hadn't been to a dentist for 50 plus years. And the only reason was dental phobia. Unfortunately, he had lost all his upper teeth and the root stumps had been infected for a long period of time. Some dental technician without understanding of the mouth had made him a top denture, which had also broken down, and he had lots of broken infected teeth in his lower jaw. All that had really had a detrimental effect on his general health. So we treated him literally yesterday under general anesthesia, where we removed all his teeth and cleaned up the infection and put implants in so that he could have a fixed set of teeth to be able to eat with. And now, hopefully, he's on his mend.
Amazing. What an incredible, incredible story. Dr. Ved, that's all the questions I have for you today. Thank you so much.
Thank you, Mariah. If you're on a journey to improving your smile, take your time and ask the right questions. And always seek understanding before making a decision, because the best decisions are informed ones. If this episode has helped you in any way, share it with someone who might need it.
This podcast is for entertainment purposes only and should not be taken as medical advice. Before making any treatment decisions, please seek independent medical advice.